work, and we are now adjusting to living with COVID-19. However, we have seen the rise in some numbers, at least yesterday, that gives us a bit of uneasiness and concern. And therefore, in this segment, we're happy to be chatting with none other than Dr. Faith B. Israel, the Secretary with responsibility for the Division of Health, Wellness and Social Protection. Morning, Dr. Faith.
Hi, good morning, Julian. Good morning, Trinidad and Tobago, everyone who's viewing and listening.
All right, joining us straight out of the East, we continue to have faith in Dr. Faith. Give us a sense of what is happening. We saw the alarming numbers at the national level, and certainly we don't want to take it for granted here in the Tobago space, because we're one country, Trinidad and Tobago, where access, is quite, get on a boat, jump on a plane, I am here and I am there in terms of the mix. And for most of us, as I like to say, in Tobago, being in the mix in Trinidad is a must by way of business and some of the activities that we have to conduct. What are your general thoughts in the first instance, or your words of guidance to the Tobago people and by extension the national circumstances given the numbers that we saw yesterday? Should we start to panic? Should we be concerned? Should we be responsible? Give us some guidance, Dr. Faith.
Well, it has been a very challenging 2 years. It's been a very challenging last couple of months. I would say do not panic, but when you see the numbers that come from Tobago in the report that we are going to release this morning, it is over 90 new cases. Now, we haven't seen a report with a number like that in a very long time. So no, do not panic, because when we panic, it means we don't act responsibly. It means we can't think when we panic. What I want us to do is to be responsible. I remember a couple of weeks ago, as we were opening up, as we were going into Easter and all of that, I reminded us that we needed to have this delicate balance between the economic activities that need to happen and the medical responsible thing to do. We had the economic activity, and now we're seeing the numbers coming back as a result of the movement, as a result of the lifting of the restrictions, as a result of people, you went from hearing the word pandemic to now hearing the word endemic, and people thinking it means that it's ended. No, the numbers show that it has not ended. As a matter of fact, the report today comes out, I think it's 95, 94, 95, if I'm not mistaken, is what would be released as new cases for Tobago for, the report that comes out at 10 p.m. The night before. So don't panic, but be responsible. Wear your mask, social distance, wash your hands, get vaccinated. Listen, earlier, the vaccines are still here. The vaccines are still very available. The vaccines are saving lives. So do what we have to do. Keep behaving responsibly. That is what we need to do.
In and around the Tobago space, Dr. Faith, there's been the general feeling, we jokingly say from time to time, having faith with Dr. Faith, but there seems to be that sense of restored hope over what is an extended period of being able to have manageable numbers. Some would say it's just luck and chance. Tell us about the specific efforts that would have taken place for where we have been able to see, not numbers as high within the Tobago space, in terms of responsibility from on the end of those in authority, as well as where individuals themselves have been taking on responsibility. So it comes as a gentle reminder, if we do the right things, we can be in a better place and a position. Give us a sense of how that has been over the last few months for us to see these kinds of numbers and get excited and say, them in Trinidad still high, but we good in Tobago.
So, as much as I would love to toot my own horn and say, hey, it's because I'm here why this is happening, I cannot do that because I understand infectious diseases. We have been blessed, and it is a blessing that the last couple of variants, primarily Omicron, and it seems like this variant of Omicron, the XE variant, have not been very, very deadly. So that is why we've not been seeing the very high rates of death in particular. We have also not been seeing the high rates of numbers, of official numbers, and I am continually warning us that the numbers we present are official numbers. The fact that we have 90 something today means that we have multiples of that running around. Now, because the variant is actually not as deadly as Delta was, it's not as sick as Delta did, it means that there are quite a bit of people with it who just do not feel sick or just never got tested or got tested privately and it was not reported. So we cannot be too lax, and I've been saying this, let us not be too lax, let us not be too carefree. Yes, people have been taking heed. Yes, and I have to be very, very thankful, for example, when it came down to the latter end of December and January, where we've had some really, really great intervention at the healthcare facilities in the ICU and so forth. And that has helped quite a bit with the numbers of deaths that we've seen, because people were going into the ICU and coming out, better. And that is a real testament to the professionals that we have within the Tobago Regional Health Authority, and I have to thank them for that. But people have to be careful that they don't just relax themselves. This is what, 2 weeks post Easter is what we are seeing right now. I do not know what will happen. We have to look at the trends. We have to look at what happens over the next week or two. We are still looking to see this new variant of Omicron, XE, what that would look like and whether it will be very, very bad or good. I mean, we are seeing that it is not as, you are not getting as sick, but we just have to kind of wait and see. And as I keep saying, we don't know what the next variant would look like. I am hoping that the next variant, if and whenever it comes, it is milder, but we simply do not know. And because we don't know, we have to keep being vigilant.
Dr. Faith, give us a sense of our progress in relation to the Roxborough Hospital with regard to the full operationalization based on the phased approach that has been taken thus far. Where are we at with that, as well as with the parallel care system in terms of treating with the same COVID-19?
Right, certainly. So the Roxborough Hospital is up and running, as you said, and I'm glad you said phased opening, because I wanted to be very, very clear. I saw someone post some time ago that they went to the hospital over the weekend and it was not open. And I was like, okay, so I guess that person did not hear me when I say that the inpatient services are not going to be up and running just yet. The target time for that is June or so. But what we have now are the outpatient, meaning if you have different clinics, you can go to Roxborough to get those clinics done. Of course, it is being managed, so you cannot just show up and say, I want to go to Roxborough. If you've been in a clinic before, if you are going to the health center and you need to go into the hospital clinic, that is being managed there. If you need dialysis and so forth, that is being managed there. As it relates to the parallel health system, we are having a bit of challenges because we're still having issues with shipments. So some of the last teeny weeny last little bit of critical equipment that need to come in are still on their way coming. They're coming. But, we kind of have to wait for that. That is just what it is. Unfortunately, because of the pandemic, because of all of the closures, we've had a lot of those companies basically shut down, and they're now trying to figure out how to get back to normal functioning. Many have not even gotten back to normal functioning just yet. So we are still delayed with the complete opening, for example, of that parallel system, but we still have the resources that are available at the Signal Hill Hospital in Signal Hill, at the Scarborough General Hospital. We still have all of the health professionals. We have been very, very diligent to ensure that those that we brought on during COVID, who were given those month-to-month short-term contracts, they are in a rolling kind of method, getting the longer 3-year contracts. So we still have the technical capacity, we still have the human resources there available. I am hoping that we don't need to use the ICU, that we don't need to go back to that, but if we do need it, it is available.
Dr. Faith, particularly looking at schools very quickly in relation to our students, young ones and so on, about their body's natural ability to be resilient and to fight off. Now that we have schools returning, any concerns, which I know some schools at the national level, what is our situation here in Tobago in particular? Because I know you'd be in close contact, the Division of Health, also with the Division of Education and schools at this point. What's your update for us in that context from the perspective of treating with this COVID-19?
Well, certainly we expect that once the children are coming together, once the children are in the same space, that if in the home of the child there is COVID and no one knows just yet and the child goes into school, that can cause COVID in the school. So we have seen instances where there are cases in school. It's not alarming. It's not any, it's not at a higher rate than what we anticipated or what we expected. So that is normal. We also have to be conscious that it's children we're dealing with. We're dealing with children. Children who don't necessarily want to wear the mask. Look, even as a full-blown adult who knows all of this about COVID, I don't want to wear the mask. Far less the children who we are asking to wear masks and wash their hands and that kind of thing. So we expect them to be cases popping up and down in the schools. The good thing is that the policy, I am really happy that the Division of Education was able to bring on their health unit, and they were able to create, in collaboration with their OSH unit, they were able to work with us and have the health policy where it's very clear in terms of if a child gets sick, what happens, what do they do, who did they call, and that kind of thing. And I think that is being ruled out pretty well. So it's not an alarming situation at all. If it were alarming, I would have made a recommendation to shut back down if that is what was necessary, but it's certainly not alarming just yet in the schools. So we have to keep watching, keep waiting, but keep being vigilant. And I keep telling the parents and the teachers, for example, that because we are dealing with children and children may not be able to follow the rules and the guidelines, you have to be more vigilant. You have to wash your hands. You have to do your wearing of the mask. You have to get vaccinated. You have to do the things that we are not expecting the children to do simply because they are young and they don't really understand the consequences.
Well, as we, in our final question here this morning, Dr. Faith, the motion would have passed yesterday in the House specific to a committee of social support staff for each division to be convened to create the policy that guides how this process is implemented by June 30th. Just give us a synopsis, Dr. Faith. I know this is going to be challenging, within about 30 seconds or so, of what that motion is intended to achieve for the average Tobagonian.
Certainly, what is intended is for the person, a client who comes into the Division of Health, Wellness and Social Protection or any of the divisions needing social support. When they come in and when they are assessed at that division, we would then reach out and we would then ensure that when we are speaking about that client or when we are determining what is best for that client, we are not just doing it with the social services people in our division, but we're doing it with all of the social services people throughout the THA. So even if the client comes by me for food, but we recognize that they need housing, that can be treated with immediately because we've done that kind of comprehensive assessment. That is what the motion is about. That is the direction that we are going.
Thank you very much, Dr. Faith, for joining us. Continuing, that ability to give us that sense of don't panic. I just want you to be responsible as persons here in Tobago and by extension at the national level, and all of you viewing, because within the region, whether you're in the world at large, we continue to face this COVID-19 challenge, and therefore we have that critical responsibility. Thank you very much again for joining us in this segment. Dr. Faith B. Israel, Secretary with responsibility for the Division of Health. Viewers, coming up in the next segment, we'll be chatting with Camille Ali, Director of the Masjid located there at Lowlands, and